Okay, so welcome back to Voices in Health and Wellness. This is the podcast where we explore the challenges and innovations shaping the future of private healthcare practice. Today, I'm excited to welcome Dr. Ryan Vaughan, a dual force in medicine and entrepreneurship. He's a board-certified otolaryngologist, and founder of Exhale Sinus and Facial Pain Center, where his team specializes in TMJ disorders, sleep and healthcare, and advanced ENT solutions. Dr. Vaughan brings a unique lens to the conversation, combining deep clinical expertise with an entrepreneurial mindset to rethink how specialty care is delivered in a private healthcare setting. If you're a clinic owner, specialist, or anyone navigating the evolving world of health delivery, you're going to find this one insightful. So, Ryan, thank you so much for joining us today. Really appreciate you jumping on the call.
Yeah, thank you for having me.
And where are you calling from, just so we all our listeners know?
I'm in my satellite office in Rockford, Illinois.
Wonderful. Okay. So I'm in the UK. Well, nice that this is a global thing. Perhaps we could start off. Could you share a little about your role and how Exhale Sinus came to be?
Sure. Yeah. So I trained as a general otolaryngologist, meaning that I was seeing anything related to the ears, nose, mouth, throat, neck, and was treating anything from birth all the way through end of life. Through that process, I actually had a couple of patients, including my own mother, who developed TMJ issues. And within the United States, we really don't have great, I would say worldwide, my experience, we don't have great treatment paradigms on how to manage these TMJ issues. It became such a passion for me that I wanted to become singly focused on TMJ, TMD, and all of the surrounding things. And really then marrying the idea of doing minimally invasive procedures to help with those conditions, as well as seemingly unrelated conditions of nasal obstruction, sleep disorder, breathing, and sinus issues. And as I started creating more and more of a treatment paradigm that was treating TMJ through what the actual triggers are, I started realizing, wow, that most of these TMJ patients have nasal obstruction as their primary driver of what's developing their issues. And if we fix that, sometimes we fix their whole problem. Or conversely, if we don't fix the nasal obstruction, they can have less success with the dental therapies that are done. So at the time that I finished my training and residency, I joined a group and was part of a 10-member group. I had worked my way up to become a partner, tried to do something just uniquely different in that practice. But, the practice had been around for 60 years. People were very entrenched in how they wanted to see healthcare delivered. And so doing something different just really didn't fit their model. Because I was so passionate about doing something different, I decided I'm just going to leave that. Left behind my partnership contract and said, I'll walk away from that and start my own thing. Really telling my wife that even if I never made more money by doing my own thing, but actually had more flexibility and freedom, that it was worth it. So that was February 1st of 2020 that I quit my job and decided to open my own practice. So then 2 weeks later, the pandemic hit and all of healthcare was shut down. So 2020 was bumpy, it was rocky. And at the same time, though, it was really an amazing time. People were more open-minded. Patients were coming into me more interested in learning about nasal breathing and nasal techniques. And I had the opportunity to slow down and learn some more things. So through that kind of bumpy start, it actually was an amazing gift that I was able to really dive deep into what are the things that we are doing that are helping our TMJ and nasal patients. What's working, what's not working, how do we set up protocols for evaluating success, how do we define success, and how do we see what's not working and how do we cut that away. So that brings us to today where I've built out a team. We have 3 surgeons, 6 mid-level providers. We call them physician assistants and nurse practitioners here in the U.S. 3 different locations. And And we continue to grow off of this paradigm, this base understanding that if we can help our patients breathe better through their nose, that we can start to really get at the triggers for the TMJ, much of the migraine headaches, much of the tension headaches, as well as the sinus issues that these patients have.
Amazing. So is your secret sauce this kind of more holistic approach to a given problem, or do you have any specific sort of techniques which are your secret sauce?
Yeah, right. I think that's a great question. Super insightful. So I really think the secret sauce is what you said in the former statement there, that it is a holistic approach. Somebody comes in to see me, and yes, I can really laser focus on how do we do a minimally invasive nasal surgery. But then there's also an extra effort that is spent. Well, we know that there's a ton of restoration that happens during sleep, for example. And we may get a sleep study that shows some disruptive sleep. We can put on a CPAP. We can do an oral appliance. But what else is contributing? What time are you eating? When's your last meal? When are you last consuming liquids? When are you turning screens off? What does your bedroom setting look like? We're diving into patients' diets. We're diving into their supplements. We're diving into their psychosocial wellness. All of this understanding, yes, I can help make a crooked nasal septum straight, but that's only a small part of the puzzle.
Amazing. Is anybody else caught onto this? Because it sounds like, I'm very much a holistic practitioner myself, so I appreciate the way that you dive into all these different aspects of the patient's lifestyle and their current problem. Is anybody else doing this in the ENT world?
So
to the level that you are.
Yeah, right. So this is where I've hired 2 other surgeons and really trying to mold them into this way of thinking and understanding. We are a unique approach. XL Sinus it's unique. There are other folks. There's one other ENT physician out in New York that advertises as a functional ENT. I have not been able to connect with her, so I don't know exactly how she's approaching things. But to my knowledge, really our angle of trying to holistically approach nasal sinus, TMJ, and headaches, I don't see it anywhere else.
Do you think, how much have you been able to reduce surgery by using this approach and not necessarily have to do something more interventional, surgical?
Yeah, right. I'd kind of reframe that to say, how do you define surgery? In that we can do minor procedures that are not a big sinus surgery. And how much do I back somebody off who maybe needed, if I would have seen them 10 years ago, done a significant sinus surgery operation, and now I can do something minimally invasive 80% of the time. Taking somebody who has, so it's part of this holistic approach, right? When I was trained, we talked about, all the way back to training, you have 2 options for breathing, your mouth or your nose. And I was trained that they were equivalent, that there's no advantage to breathing through the nose over the mouth. And we were taught in a way that somebody who's complaining of nasal congestion, we'd throw medicines at them, never really give much thought to diet, and certainly didn't give a whole lot of consideration to just a functional nasal surgery. That obviously, as I was out of residency and in more private practice world, was not acceptable. Patients really wanted better options than just throwing medications at them. But sometimes it's not just the nasal septum, right? And so then the holistic approach comes okay, what could a dentist do? Where understanding that the hard palate is the floor of the nose, and if we get a thoughtful dentist who can do a palate expansion, they can actually make a meaningful difference in some of our patients who have extremely narrow nasal airways. It's funny, it seems very common in my practice now, but even in the United States, it's not widely accepted. I will interact with orthodontists even within the last month who quite frankly thought that I was crazy talking about doing expansion on a 4-year-old, thinking, in our thought is, okay, let's get this kid the best nasal airway possible. Let's not it's not really about moving the teeth. It's really about expanding the palate so that they can breathe. And so again, back to your question of surgery versus procedures, most of the time when I'm seeing a patient, they're getting some sort of intervention. And that may be a dietary intervention, but typically it's going to be something along the lines of making the nasal airway work better.
Interesting. So what does your typical day look like at the moment? I guess you're fairly clinical, hands-on, you've got your scrubs and everything on. Or how much of it's sort of managing the business and the sort of strategy side of things?
Yeah. So as my wife says, I work all the time. I work 5 days a week clinical. So that turns out to be typically 1 day a week doing a procedure or surgery day, 4 days a week treating patients just clinically in the office. The mornings are typically involved. Most mornings I woke. My pattern is I wake up at 6 o'clock, pretty much no matter what's going on for the day. I start doing some sort of work until my wife wakes up, and then we always have coffee. I work out, hang out with my daughter before she goes to school, and then off to the office. So typically, they're starting to see patients around 9 a.m. Seeing patients until about 3:30, and then the afternoon is where I do most of my business meetings. And that's anything from podcast interviews to social media. We're doing a lot of social media pushes, meeting with the C-suite folks at our practice, the attorneys, whatever. And then I try to limit to one business dinner per week, just so I'm not away too much. I could fill my schedule with as much stuff as I want. I really have a passion for teaching and teaching this stuff, educating people about what are minimally invasive, what's the importance of nasal breathing, why do we care about nasal breathing, what are the impacts of not nasal breathing, and then what are the minimally invasive ways to do that. So I again try to stop myself and only do one of these types of educations per week. But it's another area of passion. And then that bleeds into the business side of things, where the more I educate, then the more referrals we get. And so it is a cycle where it feeds itself. But it keeps me energized, that I keep going. When you start doing what you love, you just keep going.
Of course. Amazing. So I've been doing a number of these interviews, and I've been hearing a lot from other private clinic owners, particularly in the US, around sort of rising operational pressures around staffing, insurance reimbursements, and the rise of corporate roll-ups. What's your kind of take on these things?
Yeah. So obviously, to be successful in running a business, you need to be able to figure out how to be profitable. And part of that is, the ability to manage a team comes from having a good management team, right? I have my finance guy who just takes care of the finance stuff. I have my operations woman who takes care of all of the operations, and really I get involved only at the highest level. I'm a visionary, long-term, big picture type of thinker. And so then them having all of their roles allows me to really focus on what the vision can be and needs to be. We are in a healthcare model where private insurance pays for a lot of what we do. And so the private insurance side of things, we need to figure out, how do we have enough volume coming through the office in order to keep the lights on. But part of this holistic approach, we can't have high volume, right? We have to be able to spend 30 to 45 minutes with our patients to ask them all these deep probing questions and really get to know them and their situation. So we've incorporated other therapies and things that can be going on in the background in order to have multiple revenue streams. So we have a small retail product line. We have ancillary therapies of red light therapies. We'll do infrared sauna. We have we're bringing in dentistry to do so instead of like referring out. So then we'll just keep internal. So the business side of my brain is really geared towards how do we optimize the ancillary income that is not so driven by insurance. Mm-hmm. We opened our third location in a different state, and by opening in a different state, there's just different regulations. And so in the other state, we can actually charge what's called a facility fee. And so by charging a facility fee, it allows us to get reimbursed not only for our surgical and procedural work, but actually for the overhead costs of the equipment. In the state of Illinois, they don't allow that. And so it's, clearly the laws of Illinois were written in such a way that favors the bigger hospital systems because they can charge the facility fees. But if you're a small private clinic like myself, you cannot. And so I've had to be creative in adding things to patients' procedures that allow us to be able to actually cover our costs. And that's like the idea of red light. And it really has been a self-fulfilling cycle, if you will. If I add on an ancillary treatment that actually has research backed, I really believe in it, but insurance isn't going to cover it, then we can ask patients to pay cash for it. And our population seems to really understand the benefits of these types of, say, like pick red light therapy. And so then I can add in an ancillary treatment through a procedure.
Got it. Amazing. What about trends in sleep and ENT shifting your model from the point of view of often patients
Sure.
are much more informed these days. They've read the internet, they've gone on Dr. Google, they've gone on to ChatGPT,
Yeah.
but also from the point of view of perhaps being more fragmented in their care. How have these sort of things, shifted and how do you see them?
Yeah. I'm going to go to your last point there, the fragmentation. That you're absolutely right that they do start to get fragmented, and I see my role as actually an unfragmenter, and I really try to bring in whether it's functional medicine, whether it is dentistry, myofunctional therapy. I don't know if you're familiar with that, but kind of like speech therapy, orthodontia. I often will see myself as a quarterback of, okay, I'm going to try to help kind of fan you out to like, here's each of the areas that you really need in order to defragment your care, allowing them to really get the benefits of treatment. I spend a tremendous amount of time, whether it's educating other providers, but educating patients, right? So they come in and Dr. Google may have said, okay, so here's what I know, here's what I can do. It's really incredible what you can find on Google and ChatGPT, but it's often not the whole picture. I just saw a patient this morning, and based on online learning, he was able to start a breath program, start a dietary program. Like he was mouth taping. He's doing everything he can to breathe through his nose, but he's still getting sinus infections and he still has a deviated septum. And so he's like this guy that we went through a scan this morning, and I'm like, we could send you to an orthodontist for expansion. That won't straighten your septum, but it'll at least help you breathe through your nose. And unfortunately, won't help your sinus issues. And so he's a guy, back to one of your first questions, like we're going to actually do a pretty big surgery for him because that's what he needs. He's failed everything else. And so he's the guy that's going to start here, but then we will defragment that stuff. And how does he do later? We'll determine, okay, do we send you to our sleep dentist for a dental appliance, or who are the other ancillary folks that we're going to bring in? And not everybody needs it. Not everybody wants it. But it's something that when we find that patient who really needs to dive deeper, that Google, ChatGPT, YouTube, unfortunately, just doesn't give them the ability to really get as deep as they need to go.
Got it. On a similar vein, I don't know how it is in your area, but what's your take on the rise of telehealth and retail clinics? I mean, do you see them as a threat or a complement or something else entirely?
Yeah. Definitely not a threat. We're so specialized that they're not a threat. The only threatening part of that is that when somebody comes to, whether it's a retail clinic or telehealth, complaining of ear pain and hearing loss, they're likely to be diagnosed with an ear infection and given an antibiotic, and they may not need it. And so it's not so much a threat as much as I see really as an opportunity. I've worked hard to educate a lot of the retail clinics around us, in not in any way to be demeaning, but really an ear examination is really, really difficult. And even as an ENT doctor, accurately diagnosing middle ear fluid, we're only right about 80% of the time. And so that's all we do is look in ears, and we're still wrong 20% of the time. Mm-hmm. So the expectation that a nurse practitioner at a retail clinic can get it right 100% of the time is just unrealistic. And so giving them the freedom to say, I don't know, can be super empowering. And then we actually get a bunch of referrals from these centers that say, wow, this guy was actually really nice, taught me something, and I think he'll take good care of you. Telemedicine, I educate throughout the United States, we could say internationally here. We get a lot of out-of-state referrals. And so I work with, whether it's local ENTs or local dentists, to review imaging and then do a telemedicine visit. And so I do some telemedicine visits, even in what's considered kind of a heavy procedural practice, really trying to make sure that these patients are all optimized, because back to another one of your early questions, not many ENTs really want to do this. They don't really want to dive into this stuff. They don't want to think about TMJ besides how do I get this TMJ patient out of my practice as fast as possible.
What would you say is working really well for you right now in terms of your patient care and business operations? Because you talked a little bit about how you structure your business and the various team members that you have, but what's really kind of killing it for you at the moment?
Yeah. What business-wise, what's really killing it is adopting new technology. Mm-hmm. So adopting new technology for minimally invasive sinus procedures has really allowed us to capitalize on doing less for the patient.
Brilliant. So obviously a very high-tech clinic, using all the latest procedures and everything. Amazing. And on similar kind of vein, what's the most frustrating part of doing what you do, or do you have any particular bottlenecks or challenges that you're kind of working on?
Yeah. So I'm sitting in our expansion satellite clinic out in Rockford, which is a medically underserved community. And in being medically underserved, it kills me that, so we've been in this location for less than a year, but trying to get the traditional internal medicine doctors and family practice doctors to understand the importance of nasal breathing, and that not every patient with a headache needs to be put on medications, has been a much greater challenge than I've really expected. I thought that we'd kind of walk in and people would welcome us with open arms. And as we're coming in and saying, let's try to do this in a thoughtful way without medications, and let's see what your dietary triggers are. It's a community that I'm capturing a lot of the fringe, if that makes sense. But I'm struggling to really capture the mainstream. And so I'm working hard to figure out, is it messaging? Is it I'm not getting in front of the right people? What is it that's limiting my ability to really help as many people as possible?
I understand. How do you see the role of private specialty care, sort of like yours, but not just exclusively yours, evolving over the next 3 to 5 years? So people doing your kind of niche work, or a much more focused approach to a particular problem.
Yep. So I think it depends on what happens with nationalized healthcare in the United States. I don't think it's really going to change in the next 3 to 5 years. But say that it does, I think there's going to, and I think what we're seeing is just two pathways or two tracks, if you will. There's the nationalized healthcare track that your average patient is going to just go through that tract, and then there's going to be the private. And so I think the subspecialty niche care clinic like myself is going to really thrive in that secondary track, being independent of national healthcare and working on more of private insurance or cash pay model. I think that like the practice that I left is going to have to adopt more and more national healthcare, more and more of the crummier private insurances, just to stay afloat because their margins become so thin. I see more patients becoming educated about the current healthcare system now that, you see a patient who's for the first time in their life using US healthcare, and they're just blown away by how much they have to pay in order to actually get healthcare. And they thought they had this amazing insurance policy, and they want to deny half of the procedures that the patient needs. And so there's much more disenfranchisement that's building within the United States. I don't think we're 3 to 5 years away from anything really changing dramatically. I think it needs to change dramatically, probably more in a time horizon of like 20 years. I think there'll be major changes, but 3 to 5 years, I have a feeling it's going to be basically the same.
Got it. Where do you want to be in the next sort of 6 to 12 months with Exhale Sinus? Is it sort of more growth, new services, team changes, all of the above?
All of the above. Yeah. We want more growth. So we're just opening the doors to our third location here in a couple of months. With that, we have other plans for satellite clinics there and other major hubs through different states. We just hired a friend of mine who used to do device sales, and she's going to start doing some like outside sales for us of approaching other surgeons of, we could do this differently. We could do this together. Consistently, I meet dentists throughout the United States, and the dentists seem to be some thought leaders in how to really focus on airway. And they're frustrated because they can't find an ENT doctor that really is interested in actually helping nasal airway. And so I'm working really hard in the next 12 months to connect with more ENT doctors, to teach them not only the importance of nasal airway, but also how to financially do it in a way that makes sense, that they can either be as successful or even more successful just by doing it on their own.
Brilliant. And if you could solve one big challenge, what would it be? And it might be the education piece around the doctors, I don't know, but is there anything else that you'd like to solve in your kind of growth?
From a business perspective, it'd be educating other providers. From a technical perspective, the challenge that's constantly in front of me is, how do I do a procedure on somebody and give them the best, fastest recovery possible? And that's where all these other ancillary things, from red light to saunas to hyperbaric oxygen, everything's really coming into what can I do to give somebody the fastest recovery possible.
Okay, amazing. Ryan, thank you so much for your time this afternoon. It's been a really interesting conversation. Thank you for your insight, your honesty, and the depth of the answers. It's been really fascinating. I'm sure people are going to find this an interesting listen, but I really appreciate your time, giving up your time this afternoon.
My pleasure. Thanks for inviting me.
Thank you.
Take care.